So in this video, we're going to talk about knee pain and also popping and clicking and grinding of the knee, specifically pain at the front of the knee. Now, with this, we've got to work out why that's happening. A really common cause for this is that the knee cap, rather than sitting centrally in a groove, is being pulled slightly off to the side. And that movement off to the side means that over time it starts wearing, clicking, grinding, and eventually you start to get knee pain, which can be painful when you're sat for long periods of time with your knees bent, but also going up and down stairs, you'll feel clicking and grinding and pain at the front of the knee. So what can we do to fix this? Well, what we need to do, we need to release off the muscle all up through the side of the leg here. We need to strengthen the muscle right in here. We've got two exercises to strengthen this muscle and then one stretch to stretch this muscle down the side here. We do this because it's really common for the kneecap to be pulled off to the side with the tightness on the side, pulling it around, the weakness here allowing it to go that way. The stretch we're going to look at first. Now with this, I'm going to stand up and show you the quad stretch. So we're standing here, we hold and we pull the heel to the bum, you bring your knee back in line with the other one and you push your hips forwards. What that's doing is it's stretching through the quad muscle. The benefit of pushing hips forwards and pulling the knee back is that it increases the stretch on the rectus femoris muscle, which is the muscle that crosses the hip all the way down through, crosses the kneecap. Stretching out through here is going to release off the kneecap, allow it to move back into a position it's happier to be in. So then now we need to focus on strengthening the muscle. We need to strengthen the VMO muscle right there. If we can get that nice and strong, it stabilizes the knee, but also helps to pull that kneecap slightly more into the center. So the exercise we're going to give you first is the activation exercise of your kneecap muscle, which is the VMO. So effectively seated like this, I want you to extend your leg all the way up, squeeze and contract the quad muscle at the top, and then let it drop back down. All the way up, squeeze hard at the top, and then back down. You're going to do 20 of these. 20 simple reps is going to start to activate that muscle. The more the muscle is activated and happy to work and pull its weight, the more it's going to benefit from the strengthening exercise that we're going to give it in a minute. So that exercise is done for 20 repetitions, 3, 4, 5 times a day. The quad stretch, hold for a minute and do that for 5, 6, 7, 8 times a day, regularly throughout the day. The next exercise is the Peterson step up, and this is the real strengthening exercise that we're going to give you to strengthen that muscle and get a healthier, stronger knee. All right, so now we're going to show you the Peterson step up. You need to find a step a little bit like this one, could be a little bit bigger. I wouldn't go any smaller than this, and you're going to do a step up on this right leg. I'm going to show you how you do it now. So you have the ball of your foot like this, and then when you step up, you're to there, and then lower down to there, back on the ball of the foot, and then you step up to there, back down to there. You can see I'm stepping forward with my left leg here, and I'm on the ball of my foot as I lower myself down. So then all the way up, and then all the way down through to there. This is one you're not pushing off your left leg, you're just doing the movement through this right leg. And you can see that I'm going slow and consistent, and I'm really starting to feel a build up of the muscle through here. So I'm working this muscle quite heavily, and again, flat foot down to a bent onto the ball of the foot, up to flat. So with any of these exercises that we're giving you for your knee, what we really need to make sure is that when you're doing the exercises, they may well be a little bit painful, a little bit sore while you do it, which is okay as long as when you stop the exercise, the pain stops and you feel the benefit from the exercise going forwards. But what we don't want is that you're going to do an exercise and it's going to hurt and it's going to aggravate it going forwards that day, the next day. If that's the case, you probably need to not do the exercise and see an osteopath, a chiropractor, physio, someone to look at the knee, assess the knee, work out exactly what's going on and what to do. Of course, I'm not assessing your knee, so we're making some really good assumptions, some likely assumptions about what's going on with it and which exercises are going to be the best for you to do. You give them a go. If they aggravate things, if they make it sore, of course don't do it. Speak to some sort of health professional who can look at your knee specifically and work out what's going on with it. If you want more information about knees, exercises for knees, back pain, neck pain, headaches, then of course look at my channel. I've got loads of videos. They're going to be looking, you're going to see them above. Click on the channel, subscribe. They've got loads of information for you. Have a look.